Quick disclaimer. Information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
The standard medical approach to diabetes treatment is to prescribe medication. But the question is, does it have to be? Is there a different way we can think about and approach diabetes?
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1C, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jeddah.
Hello, wonderful people. It's Dr. Jeddah here, and thanks for joining me for our chat today. Now that we're at episode 15, I feel like we're just warming up into type 2 diabetes talk. We've covered some interesting topics so far, and thanks to your ongoing input, there are a never-ending number of topics to cover in future. Now that we're in a new month, I decided to plan a theme around it. So you've actually joined me today for the first episode of Medication March, where we'll be releasing 4 episodes around the course of the month, all around the topic of medication. Have you ever felt like your doctor doesn't listen to you when you say you don't want to take medications? Have you ever felt like drugs are being pushed on you when you'd really like to try another way, a natural way? Have you ever considered the long-term side effects of medications? Do you feel like you're taking too many medications? And have you ever wondered whether reducing or stopping your medications is really possible? Well, let me just say straight up that the next 4 episodes are going to take us on an adventure, one that I hope you'll find incredibly interesting. I'm starting a discussion that I know needs to happen, and one that you need to be involved in. It's a conversation, or rather, a series of conversations that are designed to empower you to take charge of your health through education, informed decision-making, and communication. That's right, the whole idea of this Medication March series is to spark thought, get you thinking about your options and possibilities, empower you with the ability to take charge of your health, and have important medication conversations with your physician and healthcare team. And hopefully, for health professionals who may hear this series, to spark thought about the quality of their practice and in the way they're treating and communicating with you and their other patients. And once you hear this series of episodes, you might be compelled to share them with your doctor or healthcare team, as there will be lots of resources for both you and them to explore. In this first episode of this Medication March series, we'll spark this discussion by hearing from a few of our members and pondering some thoughts around their experiences. The next episode in this series, I've got a special guest joining me to chat about the dark side of medications, asking questions when it comes to meds, and how to start a conversation with your doctor. The third episode of this series, my guest joins me again to chat about her role on the advisory panel of the Federal Drug Administration, Wegovy and Ozempic, and some surprising facts. And in the fourth episode of this series, we'll cover the different types of glucose-lowering medications and their effectiveness. And we'll also chat about something that's not often discussed: deprescribing medication. This Medication March series is all part of this conversation to spark a deeper level of thinking that empowers you with confidence to make informed decisions and take charge of your own diabetes health. As we journey together through this series of discussions, please get involved in the conversation by visiting our website at type2diabetestalk.com. You can leave your comments alongside the episodes because I'd love to hear about your experiences too. You can also leave me a voice message or send me an email because, again, I'd love to hear about your experiences. And as we move through this conversation, to help you further, we will be posting links and resources alongside these episodes on our website as well at type2diabetestalk.com. And of course, for our members, you can find a wide range of resources inside the members' library alongside these episodes. Rightio, ready to dive in? Okay, let's hear from a couple of people and delve into this conversation. We'll start by hearing from Dean.
The doctor I had, well, he was a nice enough doctor, but his view on diabetes was that once you got it, it just continues to get worse and worse and worse. He said this to me one day: you will eventually die from your diabetes. It's just a matter of how much we can help to delay that, and you will eventually go from 1 tablet a day to 2 tablets to 3 to 4. You will eventually be on insulin. If we can keep you alive long enough, that's where you will eventually be. That's the way he described it to me. And I remember coming back after him saying that and saying to my wife, I need to find another doctor because I don't want to live the way this doctor is telling me I'm going to live.
Now, Dean might be laughing about this, but this is no joke. I hear this stuff from people all the time. And firstly, what I want to say about this is a doctor really should never say this kind of thing to you, especially with a new diagnosis. After hearing something like this, Dean could have very well feared for his life and could have fallen into a deep depression. He could have felt unsupported and lost, not knowing if his life would ever be enjoyable again. He could have just given up from the outset, thinking there was no point in doing anything at all. And based on what this doctor said to Dean, you'd feel there was no other course of action other than medications, especially if you knew nothing about diabetes. Like I said, this is not the kind of thing a doctor should say to you. Granted, I will say that this attitude is one that is quite deeply ingrained into the common way of thinking about diabetes. So I do hear this type of stuff from people all the time, and that's exactly why we need to spark this conversation. The standard medical approach to diabetes treatment is to prescribe medication, but the question is, does it have to be? Changing this narrative and the way we think about diabetes is more than overdue. And we certainly shouldn't be telling people such negatives, but instead inspiring hope, because there is a great deal of hope to be had. You see, once it was thought that type 2 diabetes wasn't reversible at all. No one thought that it could be put into remission or reversed. But we know from the growing evidence base that this is not true at all. There are many proactive researchers, clinicians, and healthcare professionals such as myself who are encouraging another, healthier way to live with diabetes. And the evidence is catching up slowly but surely. In 2021, we saw a global shift on this. The American Diabetes Association, Diabetes UK, Diabetes Australia, and Diabetes Canada released position statements to acknowledge the evidence that diabetes remission is in fact possible. Due to many successful nutrition programs such as my T2 diet program, deprescribing medications is becoming more widely known, slowly but surely. So the point I want to make here is that attitudes are changing. They must change. And we need this conversation to help spark a different mindset and a different conversation more broadly. We need to see a world where we're not only stating in diabetes guidelines that healthy diet, nutritional and lifestyle treatment should be the first line of treatment, but a world where this is actually happening among physicians, healthcare professionals and diabetes organisations worldwide. Together, we can change diabetes health, and that's why this conversation is so important. So let's hear a bit more from Dean, where he talks about taking the T2 diet program.
Even my current doctor, she's much younger doctor. She was very interested when I told her about going on to the diet. But even she was, it was hard for me to convince her to let me get off the first tablet, let alone the second one. The doctors, they're not game enough to take new ideas on too strongly.
Interesting about Dean's thoughts on doctors not wanting to take new ideas on too strongly. What I'll say about this is that using diet and nutrition as a primary treatment strategy isn't a new idea. I think somewhere along the way, we've all just got a bit lost in the medical model, in thinking medication is the only way, and in letting go of wellness as a priority. Look, I get it. It's good for a doctor to be somewhat conservative, but the question is, how conservative do they need to be? Dean lowered his HbA1c by 1.3% down to a normal range of 5.6 in 16 weeks. Initially, the doctor took him off Jardiance, a sulfonylurea medication, and reduced his metformin dosage down to a minimum dosage of 500 milligrams a day, and this is where it stopped. But the thing is, over a year, Dean had maintained an A1C below 5.8, so when is conservative being way too hesitant? If you are to stop a medication and A1C rises again, you can always take the medication again. But what if you continue to do just as well without it? It's important that there's action and not too much resistance to change. And that's a conversation that needs to be had with your doctor all the time, as we'll be discussing throughout this Medication March series. And I'll also be sharing some interesting statistics and facts about deprescribing in episode 18, the fourth instalment of this series. So you definitely don't want to miss out on that.
Get proven, practical support to lower blood sugar, weight, and medication. Check out Dr. Jetta's programs and services at type2diabetestalk.com/programs.
Next, I want to share a comment and question submitted by Jean. Jean said, I am a 64-year-old female. I have type 2 diabetes. My question is this: why is it that you put a patient that has no problems at all on metformin? I was taking one in the morning 500 milligrams and one in the evening 500 milligrams, but I feel the metformin was not the right prescription. I had an A1C of 11 and changed my diet, and my A1C is a 6. Since all of the bad things I've heard about metformin, I only take 500 milligrams a day, and I'm doing my best to stop taking it at all. My question is this a bad thing? Well, if I were your physician and had seen you achieve such great A1C success with diet and lifestyle, I would certainly be congratulating you, and I would not be prescribing medication. An A1C of 6% is excellent, so in my opinion, and based on the evidence as well, there should be no medication necessary in this case, and this is especially so if you maintain this level of A1C. We know overprescribing medication is common, and people being on too many medications unnecessarily is common as well. We're going to be discussing this more during this series because it really is such an important issue to address. In terms of reducing medications, it sounds like Jean halved her dosage of metformin at home from 1,000 milligrams a day down to 500, and she wanted to stop it altogether. It is usually best to discuss reducing medication with your physician before doing it. In Jean's case, because A1C is already so good, reducing or stopping the metformin wouldn't likely be an issue at all, but like I said, it is best to discuss reducing medication with your physician before doing it. Importantly, don't be afraid to ask them questions and to question what they are doing and why. Now, faced with this kind of situation, that doesn't necessarily mean your physician or healthcare team will actively support you. Let's recap a few things Wilma had to say back in episode 7.
I decided that, I would change my eating plan and do all that. So in 4 months, went back to the diabetic clinic, and my blood sugar had gone from 22 to 10. I was doing the happy dance because I thought I worked really hard. I thought they would be excited, and they were like, not, because it was still 10. It was still too high. Still wanted to prescribe metformin. And I said, okay. So in the 4 months, I brought my blood sugar from 22 down to 10. Give me another 4 months and let's see what happens. So left again without going on metformin. And when I went back the second time, I think it was high 7s, maybe. Again, I was elated. So anyway, I finally stopped going because I found it so depressing every time I went, because they were more interested in pushing the medication than they were in helping me control my numbers. So I stopped going.
Even though we know that diet and nutrition are the best form of treatment where people can achieve incredible health without medication, like Wilma did and continues to do, we can see how the journey can be difficult to navigate. Like Wilma, you may have felt or perhaps will feel under pressure by your physician or healthcare team to take medications. Maybe like Wilma, you have felt or feel unsupported by your physician or healthcare team, like they are not really listening to what you want. Like Wilma, maybe you walk into the office feeling great because you've made such a positive change and such great progress, only to leave feeling deflated and depressed from the way you've been treated. Let me just say, this should not be happening. You shouldn't feel like you have to stop going to the diabetes clinic or your doctor because they aren't listening to you, because they're pushing drugs, because they're not supporting you. This just shouldn't be happening. But the unfortunate reality is that this happens all the time. And this is also what Medication March is all about, making you aware that we do have big issues in our healthcare system, making you aware that you're not alone in this struggle against the medical machine, letting you know you're not alone in navigating the difficulties of these situations, and most importantly, helping you build the confidence to take charge of your own health and spark this conversation with your physician and healthcare team, because you are the one who is central to your own health and they should be listening to you and working with you at all times. You have to take the reins, of course. Be proactive with your health. I mean, if you want to chug down Coca-Cola and handfuls of candy each day, then stick your head in the sand, you're going to need medications and probably multiple medications. But that doesn't mean your diabetes is getting better. It may make your blood sugar levels look better for a time, but you're just masking the symptoms. At some point, something else is going to give, and you'll either be taking more and more meds or your health will seriously decline. Like I said, you have to take the reins and be proactive with your health. That's what this podcast is all about, treating your diabetes naturally with nutrition and lifestyle, which we know is highly effective in achieving and maintaining normal blood sugar, re-altering your metabolism back to normal and optimizing your overall health, and most importantly, reducing your reliance on medication. I want to add that I'm not against medication. I acknowledge they are useful and people sometimes need to take them. Medications can save lives, but we don't really want to see you solely relying on medications. That's why this conversation is so important. We don't want to see overprescribing continuing to occur. That's why this conversation is so important. We don't want you to be taking pills forever that you don't really need. That's why this conversation is so important. We don't want you and your goals to be ignored. That's why this conversation is so important. We want you to be an active part of your own health. We want you to be educated, knowledgeable, and informed. We want you to feel like you can take charge of your own health. And that's why this conversation is so important. So I invite you to participate in this conversation. Think about your own experiences and goals and use the information we share in the coming weeks to take charge of your health. As we journey together through this series of discussions, please visit our website at type2diabetestalk.com. You can leave your comments alongside the episodes, or you can leave me a voice message or send me an email. And please share these episodes with friends, family, and colleagues. This really is such an important conversation. And as we move along, and you'll see it unfold, and you'll understand how important it really is. And the more people involved, the more opportunity we have to make a big difference in the lives of many. Remember, this Medication March series is designed to empower you to take charge of your health through education, informed decision-making, and communication. And in the next episode in this series, I've got a special guest joining me to chat about the dark side of medications, asking questions when it comes to meds, and how to start a conversation with your doctor. Dr. Jeddah, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. U.S. Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.